Good afternoon, all. So this is a week microsensor implantable device and rodent surgeries for biomedical application. So this is a problem solving session. I'm Arpita Biswas, a PhD scholar from Electrical Engineering Department from IIT Jodhpur. So let's start the session. So this is more details about me. And in this session, we are going to discuss about some of the MCQ question. It will clear your doubt also. So this is the question number one. What is the full form of the DBS in Parkinson's implant? First option is deep brain stimulation. Second option is deep brain stimulations. And third option is deep brain stimulations. And option D is the direct brain stimulation. So please go through the question carefully and then try to solve the question. So what is the right option? The right option is option C. Okay. Um, deep brain stimulations. Okay. So next, move towards the question number two. What are the two types of electrical stimulation used for curing the Parkinson disease with the help of neural implant? First option is the surface brain stimulations and deep brain stimulation. Second option is the cortical stimulation and spinal stimulation. Third option is renal stimulation and spinal stimulations. And option D is vagal stimulation and deep brain stimulation. So please go through the question carefully and try to solve the question. So what is the right option? The right option is option A, surface brain stimulations and deep brain stimulations. Okay. So next move toward the question number three. Spinal column stabilization on the rat is done by first option is the mechanical stabilization setup. Second option is the mechanical impounder. The third option is the stereotaxic apertures, and option D is all of the above. So please go through the question carefully and try to solve the question. So what is the right option? Question number three. The right option is option A, the mechanical stabilization setup. Okay. So next move toward the question number four. The spinal injury in the rat is induced by first option is the mechanical stabilization setup. Second, the mechanical impounder. Third, the stereotaxic apertures. And option D is all of the above. So which one is the right option? So what is the right option? So question number four. The right option is option B. Okay. Mechanical impounder. So next move toward the question number five. The spinal injury in rodent to stimulate the direct body injury is done by first option is the impounding after completely exposing to the spinal cord. Second option is the impounding without removing the skin layer. Third option is impounding after exposing the muscle layer. And option D is impounding on the spinal column just after the skin incision. So please go through the question carefully and try to find out the right option. What is the right option? The right option is the spinal injury in rodent to stimulate the direct body injury is done by question number 5 is option D. Impounding on the spinal column just after the skin incision. Okay. So next move toward the question number 6. What is the space between the spinous process and the dura called? So first option is the epidural space, second is the venal space, option C is the subdural space, and option D is the interdural space. So please go through the question carefully and find out the right option. Question number 6, what is the right option? The right option is option E, epidural space. Okay, so next move to the question number 7. So what are the two types of anesthesia given to the rodent? First option is the neural anesthesia and the general anesthesia. Second option is the general anesthesia and the local anesthesia. And option C is the global anesthesia and the local anesthesia. And option D is the general anesthesia and focal anesthesia. So what is the right option? So what is the right option? Right option is option B, general anesthesia and the local anesthesia. So next question number 8. What is the category of drugs used for the anesthesia in rodent? First is the anesthetic. Um, Second option is the analgesic. And option C is the antipyretics. And option D is both A and B. So please go through the question carefully and find out the right option. The right option. The right option is option A, the anesthetic. Okay. So next move toward the question number 9. What is the full form of the abbreviations IM and IV used in anesthesia? First option is the intramuscular and intravenous. Second option is the intramodal and the intravenous. And third option is the intermuscular and intravenous. And option D is the intermodal and the intravenous. So, what is the right option? So, what is the right option? So, question number 9, the right option is option A, intramuscular and intravenous. Okay. So, next move toward the question number 10. What are the ways of administrating general anesthesia in rodent? First option is injection and inhalation. Second option is injection and infusion. Third option is inhalation and infusion. And option D is infusion and induction. Okay. So, what is the right option? What is the right option? Right option, option A, the injection and inhalation. Okay. So next move toward the question number 11. What are the primary purpose of neural implant in Parkinson disease treatment? First option to cure the Parkinson disease permanently. Second to enhance the memory and learning abilities. Third option to regulate the abnormal brain signal and reduce the symptoms. And option D is to replace the damaged neurons. So what is the right option? Okay, I'm coming in 1 minute. Please try to solve the question. So what is the right option? The right option is option C. Regulate the abnormal brain signal and reduce the symptoms. Okay. So next move toward the question number 12. Which of the following is the most common neural implant used in Parkinson's disease? First is the vagus nerve stimulator. Second is the deep brain stimulation device. Option C is the uh, cochlear's implant, and option D is the spinal cord stimulator. So, what is the right option? The right option is option B, the deep brain stimulation device. Okay. So, next move toward the question number 13. Which brain region are typically targeted in deep brain stimulations for Parkinson's disease? First option is the cerebellum and occipital lobe. Second option is the subthalamic nucleus and global pallidus interna. And option C is the hippocampus and amygdala. Option D is the medulla and pons. So, what is the right option? What is the right option? Right option is option B, subthalamic nucleus and globus um, pallidus interna. Okay, so next move toward the question number 14. How does deep brain stimulation helps Parkinson's disease patients? First option is deliver the electrical impulses to a specific brain region to reduce the motor symptom. Second option, it increases the dopamine production in the brain. Option C, it destroys the overactive neurons in the brain. And option D is prevent the progression of Parkinson's disease. So what is the right option? So the right option is option A. It delivers the electrical impulses to a specific brain region to reduce the motor symptoms. Okay. So next move toward the question number 15. Which of the following is a major risk associated with the neural implant for Parkinson disease? First option, infections and hardware malfunctions. And option B is the increased dopamine production. Option C is the permanent paralysis. And option D is the increased risk of stroke. So, what is the right option? So, what is the right option? The right option is option A, infections and um, hardware malfunction. Okay. So, next move toward the question number 16. What is the key advantage of deep brain stimulation over the traditional Parkinson disease medications? First option, it provides the long-term symptoms control with the fewer side effect. Option B is it eliminates the need for any medications. Option C is permanently cures Parkinson's disease. Option D, it works only in the early stage of the disease. So the right option is option A. It provides a long-term symptoms control over the fever side effect. Okay. So next move towards the question number 17. Which neurotransmitter is most affected in Parkinson disease, leading to motor symptoms? Serotonin. Second option is dopamine. Third option is acetylcholine. And option D is the glutamate. So right option is option B, dopamine. Okay. So next move toward the question number 18. Which technology is commonly used to guide the implantations of deep brain stimulation electrode? So first option is the MRI and CT scan. Second option is the X-ray imaging. Option C is the electrocardiogram, and option D is the ultrasound. So what is the right option? Option A is the MRI and a CT scan. Option B is the X-ray imaging. Option C is the electrocardiogram. And option D is the ultrasound. What is the right option? The right option is option A, the MRI and CT scan. Okay. So next question number 19. Which of the following is symptoms is more effectively treated by deep brain stimulation? First is the tremors and the rigidity. Option B is the memory loss. Option C is the depressions. Option D is the speech difficulties. So which of the following symptom is most effectively treated by deep brain stimulation? So the right option is option A, tremors and rigidity. Okay, next move toward the question number 20. What is the primary goal of a spinal microneurosurgery? First option to relieve nerve compression and restore spinal function. Option B is to replace the entire spinal cord. Option C to enhance the brain function, and option D is the stimulate the muscle growth. So what is the right option? The right option is question number 20, option A, to relieve the nerve compressions and restore the spinal function. Okay. So next move toward the question number 21. Which tool is essential for performing the spinal microneurosurgery? First is the scalpel, and option B is the operating microscope. Option C is the endotracheal tube, and option D is the pacemaker. So, what is the right option? So, right option is option B, the operating microscope. Next, move toward the question number 22. What is the main advantage of the microneurosurgery over the traditional spinal surgery? First option is minimally invasive with the reduced tissue damage. Second option is the requires no anesthesia. Option C is completely eliminates the risk of spinal cord injury. And option D is only takes a few minutes to complete. So it is the right option. So what is the right option? Question number 22. The right option is option A. Minimally invasive with the reduced tissue damage. So question number 23. Which of the following is the common risk associated with the spinal microneurosurgery? So first option is the infection and nerve damage. Second option is increased IQ. Option C is the faster bone growth. And option D is the complete immunity to pain. So what is the right option? So the right option is option A, infection and nerve damage. Okay. So next move toward the question number 24. Which of the following spinal conditions may require a micro discectomy? First option is the lumbar disc herniations. Option B is the brain tumor. Option C is the multiple sclerosis. And option D is the carpal tunnel syndrome. So what is the right option here? So the right option is option A, the lumbar disc herniations. Okay. So next, move to the question number 25. How does a spinal microneurosurgery help patients recover faster? First option by using a small incision, reducing blood loss and minimization tissue damage. And option B is by replacing the spine with the artificial implant. And option C is by completely avoiding the anesthesia. Option D is by eliminating the need for physical therapy. So, what is the right option here? So, question number 25, the right option is option A. By using the small incision, they are reducing the blood loss and minimizing the tissue damage. Okay. So, next, move to the question number 26. Which specialists typically perform Spinal microneurosurgery. So first option is the neurosurgeon, second is the cardiologist, third is the dermatologist, and option D is the pulmonologist. So please find out the right option. So what is the right option? Question number 26, the right option is option E, the neurosurgeon. Okay. Next, move toward the question number 27. Which technique is often used to remove the herniated disc during the spinal microneurosurgery? First option is the microdiscectomy. Second option is the angioplasty. Third option is the lobotomy. Option D is the thorac, uh, thoracotomy. So what is the right option here? What is the right option? The right option is option A, uh, microdissectomy. So next move toward the question number 28. What is the primary purpose of the anesthesia in rodent during the research studies? First option is prevent the pain and distress during the procedures. Option B, to make the rodent sleep permanently. And option C, to increase their metabolism. And option D, to enhance their cognitive function. The right option is option A, to prevent the pain and distress during the procedures. Next, move toward the question number 29. Which of the following is the commonly used inhalational anesthesia for rodent? First is the isofurin, second is the ketamine alone, third is the atropine, and second is the diazepam. So, what is the right option? So, what is the right option? Question number 29. The right option is option A, the isofurin. Okay, so next move toward the question number 30. Which injectable anesthesia combinations is commonly used in rodent? First is the ketamine and xylazine. Option B is the morphine uh, aspirin. Third option is the halothane and nitrous oxide. And option D is the propofol and lidocaine. So, what is the right option? The question number 30. The right option is option A, the ketamine and the xylazine. So next question number 31. Which of the following is an advantage of the inhalation anesthesia in rodents? First option is the rapid induction and recovery. Second is the no need for oxygen supply. Option C is requires deep shaded sun before use. And option D is it causes the fewer side effects than injectable anesthesia. What is the right option? Question number 31. The right option is option A, rapid induction and recovery. Okay. Next, move toward the question number 32. Which physiological parameter is most important to monitor during the rodent anesthesia? First option is the respiratory rate and body temperature. Second is the tail movement. Option C is the hair color change. And option D is the pupil dilation. So, what is the right option? So, please try to solve the question. So, what is the right option? Question number 32. So, the right option is option A, respiratory rate and body temperature. Okay. So, next move toward the question number 33. Which anesthetic agent is commonly used for long duration surgical procedures in rodent? First option is the isoflurane with the oxygen support. Option D is the acetaminophen, and option C is the paracetamol, and option D is the diazepam. So, what is the right option? What is the right option? The right option is option A, the isoflurane with the oxygen support. Okay. So next move toward the question number 34. How can anesthesia depth be assessed in rodent? First option by checking the pedal withdrawal reflex and respiratory rate. Second option measuring the blood glucose level. Option C is observing the grooming behavior. And option D is the checking vocalization patterns. So what is the right option? So what is the right option? Question number 34, the right option is option A. By checking the pedal with withdrawal reflex and the respiratory rate. Okay. So next move toward the question number 35. What is the primary purpose of physiological monitoring in rodent during the experiments? First option to ensure the animal well-being and accurate experimental outcomes. Second option to increase the metabolic rate. Option C to reduce the food consumption, and option D to improve for growth. So what is the right option? Question number 35. The right answer is option A, to ensure the animal well-being and the accurate experimental outcome. Okay, so next move toward the question number 36. What is the primary purpose of lithography in microfabrication? First option to transfer the pattern onto a substrate for circuit fabrication. Option B to melt silicon wafers, and option C to remove the unwanted metal layers, and option D to increase the conductivity of a material. So go through the question carefully and try to find out the right option. 36, the right option is the transfer pattern onto a substrate for circuit fabrication. Okay. So next move to the question number 37. Which of the following is applied to the substrate before exposure in lithography? First option is the photoresist. Second option is the etching solution. Option C is conductive ink. Option D is the dielectric layer. So it is the right option. Question number 37. The right option is the photoregist. Okay. Next question number 38. So this is the last question. What is the purpose of mask in the photolithography? So first option is define the pattern that will transfer onto the substrate. Option B to protect the substrate from the chemicals, and option C to enhance the adhesion of the photoresist, and option D to clean the wafer surface. So go through the question carefully and try to find out the right option.
So the right option is option A, to define the pattern that will be transferred onto the substrate. So we are ending the session here. Next we will meet next Tuesday, 7 to 9 p.m. Okay.